Hello guys, welcome to my channel Twastramanas. In this video, we are going to cover 6 types of counseling, and those are 1. Individual counseling, 2. Marriage couple counseling, 3. Family counseling, 4. Group counseling, 5. Career counseling, and 6. Substance abuse counseling. This video is going to be long, so feel free to take breaks in between. Let's start. Family counseling is a specialized field within psychotherapy that focuses on improving communication, resolving conflicts, and enhancing relationships within families. In this guide, we will explore the stages, models, and tools commonly used in family counseling, along with real-life examples to illustrate their application. Stages of family counseling. 1. Assessment phase. Objective. The initial stage involves gathering comprehensive information about the family dynamics, history, and presenting issues. Tools. Various assessment tools such as genograms, family maps, questionnaires, and interviews are used. Example: the counselor conducts individual interviews with each family member to understand their perspective on family dynamics, communication patterns, and areas of concern. For instance, in a family where parents are arguing frequently, the counselor may discover through interviews that the children feel caught in the middle and are experiencing emotional distress as a result. 2. Goal setting. Objective. Collaboratively establish clear and achievable goals for counseling based on the assessment findings. Tools. SMART goals. Specific, measurable, achievable, relevant, time-bound are often utilized to ensure clarity and effectiveness. Example: after assessing the family's issues, the counselor and family members agree that improving communication and reducing conflicts are primary goals for counseling. For instance, the family sets a SMART goal to have at least one family meal per week, without arguments or tension, aiming to improve overall communication and connection. 3. Intervention phase. Objective: implement strategies and techniques to address identified issues and achieve the established goals. Models. Various therapeutic models such as structural, strategic, Bowenian, narrative, and solution-focused are applied based on the specific needs of the family. Tools. Communication exercises, role-playing, reframing, boundary setting, and other interventions are utilized to facilitate positive change. Example: in a family experiencing frequent conflicts, the counselor employs role-playing exercises to help family members practice assertive communication and conflict resolution skills. For example, family members may role-play a recent argument and then switch roles to gain perspective and empathy for each other's experiences. 4. Evaluation and adjustment. Objective: regularly assess progress towards goals and make necessary adjustments to the therapeutic approach. Tools. Outcome measures, feedback sessions, and ongoing assessment of the family's functioning are conducted. Example: the counselor periodically reviews the family's progress towards their goals and adjusts interventions accordingly. If certain strategies are not yielding desired results, alternative approaches may be explored. For instance, if the family's conflict levels remain high despite communication exercises, the counselor may introduce additional techniques such as mindfulness or stress management to address underlying emotional triggers. Models of family counseling. Under 1. Structural family therapy. Overview. Developed by Salvador Minuchin, this model focuses on restructuring the family system to establish clear boundaries, hierarchies, and roles. Application. Example: a family struggling with power struggles and boundary issues may benefit from structural interventions aimed at clarifying roles and responsibilities. For instance, the counselor may work with the family to create a family chore chart and schedule to redistribute responsibilities and promote cooperation. 2. Strategic family therapy. Overview. Originated by Jay Haley and further developed by Chloe Madenes, this model emphasizes solving specific problems through directive interventions and strategic planning. Application. Example: a family facing challenges with adolescent defiance may benefit from strategic interventions aimed at implementing clear and consistent consequences for behavior. For example, the counselor may help the family develop a behavior contract outlining agreed-upon rules and consequences for non-compliance. 3. Bowenian family therapy. Overview. Developed by Murray Bowen, This model focuses on understanding and addressing intergenerational patterns of behavior, differentiation of self, and emotional triangles. Application example: a family struggling with enmeshment and emotional cutoffs may benefit from Bowenian interventions aimed at fostering individual autonomy and healthier boundaries. For instance, the counselor may encourage family members to maintain regular contact with extended family members while also prioritizing their own emotional well-being and independence. 4. Narrative therapy overview. Developed by Michael White and David Epstein, this model externalizes problems and helps families rewrite their narratives, empowering them to separate from the influence of dominant problem-saturated stories. Example: a family grappling with a history of trauma may benefit from narrative interventions aimed at reframing their experiences and identifying strengths and resilience. For example, the counselor may assist the family in creating a collective narrative that emphasizes their ability to overcome challenges and support each other through difficult times. 5. Solution-focused therapy overview. Developed by Steve DeShazer and Insoo Kimberg, this model focuses on identifying strengths, resources, and solutions rather than dwelling on problems. Example: a family experiencing chronic conflict may benefit from solution-focused interventions aimed at amplifying moments of cooperation and building on existing strengths. For example, the counselor may encourage the family to identify times when they successfully resolved conflicts in the past and explore what strategies were effective in those situations. Tools used in family counseling. 1. Genograms overview. Visual representations of family relationships and dynamics, often spanning multiple generations. Example: the counselor collaborates with the family to create a genogram, which provides valuable insights into family patterns, relationships, and potential sources of conflict. For example, the genogram may reveal a history of divorce or substance abuse that contributes to current family dynamics. 2. Communication exercises overview. Activities designed to improve communication skills within the family, such as active listening, assertiveness training, and conflict resolution techniques. Example: the counselor leads the family in communication exercises, such as mirroring and paraphrasing, to enhance empathy, understanding, and mutual respect. For example, family members may practice active listening by taking turns expressing their feelings and summarizing each other's perspectives without judgment. 3. Questionnaires and inventories overview. Structured assessments used to gather information about family functioning, communication patterns, and areas of concern. Example: the counselor administers validated questionnaires and inventories, such as the Family Assessment Device, FAD, or the Circumplex model, to assess the family's strengths and challenges. For example, the questionnaire may reveal high levels of conflict and low levels of cohesion within the family, highlighting areas that need attention. 4. Role-playing overview. Technique used to explore different perspectives, practice new behaviors, and develop empathy within the family. Example: family members engage in role-playing exercises to simulate challenging situations and experiment with alternative ways of responding, fostering insight and skill development. For example, parents may role-play a disagreement about parenting styles and then brainstorm collaborative solutions to address their differences. 5. Homework assignments overview. Tasks assigned between counseling sessions to reinforce therapeutic goals, practice new skills, and promote generalization of learning. Example: the counselor assigns homework tasks such as journaling exercises, communication challenges, or collaborative problem-solving activities tailored to the family's specific needs and goals. For example, the family may be asked to keep a gratitude journal and share their entries with each other at the next session to promote positivity and connection. Conclusion: family counseling is a multifaceted and dynamic process aimed at promoting understanding, collaboration, and positive change within families. By employing a variety of stages, models, and tools, counselors can empower families to navigate challenges, strengthen relationships, and cultivate resilience. Effective family counseling requires a strengths-based approach, cultural sensitivity, and a commitment to fostering meaningful and lasting transformation within the family system. Group counseling is a dynamic and powerful therapeutic approach that harnesses the collective wisdom, support, and shared experiences of individuals facing similar challenges or goals. It is guided by various stages, models, and tools designed to facilitate growth, healing, and personal development within a group setting. Let's delve into the intricacies of group counseling, exploring its stages, models, and tools while weaving in real-life examples to illustrate their application. Stages of group counseling. 1. Formation stage. In this initial stage, members acquaint themselves with one another, and the group's purpose is established. Trust and rapport building are crucial during this phase. For instance, in a group aimed at helping survivors of domestic violence, members may share their stories tentatively, gauging each other's reactions and forming connections based on shared experiences. Example: in a group for survivors of natural disasters, such as hurricanes or wildfires, members may initially share basic information about their experiences, such as where they were when the disaster occurred and how it affected them. Trust begins to form as individuals realize they are among others who have faced similar challenges. 2. Orientation stage. Here, the group's norms, rules, and goals are clarified, setting the tone for future interactions. A counselor may outline confidentiality agreements and encourage active participation. In a group focused on addiction recovery, members might discuss the importance of honesty and confidentiality, establishing a safe space for vulnerability. Example: in a group for parents of children with autism spectrum disorder, ASD, the counselor may outline group norms such as respecting confidentiality and practicing active listening. Members may express relief at finding a safe space where they can openly discuss their fears and frustrations without judgment. 3. Transition stage. This phase is marked by increased openness and self-disclosure as members begin to identify with the group and its purpose. Bonds strengthen, and individuals may confront resistance or ambivalence towards change. For example, in a grief support group, members may express feelings of anger or guilt as they navigate the complexities of loss. Example: in a group for individuals recovering from substance abuse, members may start to disclose personal struggles with addiction and their motivations for seeking help. As they witness others' courage in sharing their stories, individuals begin to feel less alone in their journey towards recovery. 4. Working stage. The crux of group counseling. This stage involves deep exploration, processing, and problem solving. Members offer and receive support, challenge each other's perspectives, and explore new coping strategies. In a group for adolescents struggling with self-esteem, members might engage in role-playing exercises to practice assertiveness and challenge negative self-talk. Example: in a group for individuals with chronic pain, members might engage in discussions about pain management techniques and share their experiences with different treatments. Through mutual support and feedback, members explore new coping strategies and challenge limiting beliefs about their pain. 5. Consolidation stage. As the group nears its conclusion, members reflect on their growth, accomplishments, and challenges. Closure rituals are introduced, and plans for maintaining progress are discussed. In a group addressing social anxiety, members might create individualized exposure plans to continue facing feared situations outside of the group context. Example: in a group for caregivers of Alzheimer's patients, members reflect on the progress they've made in accepting their loved one's condition and managing caregiver stress. They discuss strategies for self-care and vow to continue supporting each other beyond the group sessions. 6. Termination stage. In this final stage, the group formally concludes, and members bid farewell to one another. Emotions may range from sadness to gratitude as individuals reflect on their journey together. Follow-up resources and support networks are provided to facilitate continued growth. In a veteran support group, members might exchange contact information and commit to staying connected post-group to provide ongoing support. Example: in a group for veterans struggling with PTSD, members express gratitude for the support they've received and the progress they've made in coping with their trauma. While saying goodbye is bittersweet, they exchange contact information and commit to staying connected for ongoing support. Models of group counselling. 1. Psychoeducational model. This model emphasizes the acquisition of knowledge and skills to address specific issues or challenges. In a group focused on stress management, members might learn about the physiological effects of stress and practice relaxation techniques such as deep breathing and mindfulness. Example: in a group for individuals with type 2 diabetes, members learn about the importance of diet, exercise, and medication adherence in managing their condition. They receive practical tips for meal planning and exercise routines to empower them in their self-care journey. 2. Cognitive behavioral model. Rooted in cognitive restructuring and behavior modification, this model targets maladaptive thoughts and behaviors. In a group addressing depression, members might identify cognitive distortions and practice reframing negative thoughts using evidence-based techniques like cognitive restructuring. Example: in a group for adolescents with anxiety disorders, members identify common cognitive distortions such as catastrophizing or black and white thinking. Through cognitive restructuring exercises, they challenge these distortions and develop more adaptive ways of thinking about their fears. 3. Interpersonal process model. This model explores the dynamics of interpersonal relationships within the group as a microcosm of broader social interactions. In a group for individuals with social anxiety, members might explore patterns of avoidance and engage in role plays to practice assertive communication and boundary setting. Example: in a group for LGBTQ+ youth, members explore their experiences of discrimination and social rejection, as well as their strategies for building supportive relationships. Role-playing exercises help them practice assertive communication and boundary setting in various social contexts. 4. Psychoanalytic model. Drawing from Freudian theory, this model delves into unconscious conflicts and defense mechanisms that shape behavior. In a group for individuals with unresolved trauma, members might explore how early experiences influence present-day relationships and coping strategies. Example: in a group for adults with unresolved childhood trauma, members explore how their early experiences shape their current patterns of relating to others and coping with stress. Through dream analysis and free association exercises, they uncover unconscious conflicts and defense mechanisms. Thank you for your time, and I hope you liked the video. Please share, subscribe, and like the video. It will give me motivation to create more contents like this and to help you help your loved ones. Stay tuned for more.